Hello everyone and welcome to my research. So more than 8 out of 10 Scottish adults have access to the internet for their own personal use. And on average, the internet user spends about 2.5 hours a day on their mobile phones browsing the internet. And this adds up to about 17 hours a week. So can I please get a show of hands from the audience and the panel? Who has ever self-diagnosed themselves just on their smartphones or any use of the internet? Yes, almost everyone. I have myself as well. Even as a nurse, I can quite confidently say I do this all the time when I'm ill. So you guys would also be perfect candidates for my research. So as you can see also here, I've got a really good example of what someone might look before a web search and the possible aftermath of one. So my aim is to explore how self-diagnosing can affect the patient and healthcare relationship. And I really hope to be able to provide recommendations for healthcare professionals and for publishers of online medical information websites so that we can reduce the risks of online self-diagnosis and upside its maximum potential. So while academic interest in this area is really strong in the USA at the moment, it is still an emerging area in Scotland and in the UK. And prior to this, there was no other Scottish studies found, so this will be the first Scottish study in this research. So one of my plans is to compare a country that has to pay for their healthcare, such as the USA, and then analyse how they use the internet for self-diagnosing and with the use of the online forums, and then compare these results with a non-paying healthcare country like Scotland and see if there's any significant differences in the way that we use the internet for that purpose. So in my slide I've covered areas that I'm going to go over in my thesis, and I've also included my study samples, which are adult patients, nurses, and physicians. And this is going to be the first study in this area that includes nurses. So the advantages of self-diagnosing are, of course, that it is free, it creates an online community, and it gives someone a little bit more satisfaction when they go online and they see that other people are experiencing the same symptoms that they are. But there are, of course, downfalls as well, and that is that not every website that you visit is going to be a reliable medical source, and also you might not get all of the symptoms covered and you might miss the mark as well. So my questions are: how is online self-diagnosing affecting the patient and healthcare relationship? What online medical resources are available? And how can we use technology that will help us and not harm us? So please use Dr. Google safely, and thank you everyone for listening.